Welcome to this rapid review of blood pressure determinants. In this video, we will cover key factors that influence blood pressure. First, you must remember that blood pressure is the product of cardiac output and systemic vascular resistance. Cardiac output is the amount of blood ejected by the heart in 1 minute. Higher cardiac output increases blood pressure, while lower cardiac output decreases it. Systemic vascular resistance refers to the resistance to blood flow offered by all of the systemic vasculature. Increased systemic vascular resistance raises blood pressure by making it harder for blood to flow through the vessels. Understanding the factors that affect cardiac output and systemic vascular resistance is essential for comprehending how blood pressure is regulated. So now, we will explain the primary factors that regulate cardiac output, including heart rate and stroke volume. So now let's talk about heart rate, which is the number of heartbeats per minute. An increase in heart rate generally leads to an increase in cardiac output, provided stroke volume remains constant. Heart rate is mainly regulated by the autonomic nervous system. The sympathetic nervous system increases heart rate through the release of norepinephrine, which activates beta-1 receptors in the heart. Some adrenal disorders, as pheochromocytoma, which is a tumor of the adrenal gland, can secrete high amounts of catecholamine, epinephrine, and norepinephrine, leading to increased heart rate and elevated cardiac output. Also, taking a positive chronotrope as beta agonist can increase heart rate. So now let's talk about the relationship between stroke volume and cardiac output. Stroke volume is the volume of blood pumped from the left ventricle with each beat. Higher stroke volume increases cardiac output, while lower stroke volume decreases it. Stroke volume depends on several factors, including cardiac contractility, preload, and afterload. Enhanced cardiac contractility increases stroke volume by expelling more blood with each contraction, thus increasing cardiac output. Cardiac contractility is influenced by several factors, as SNS activation, the sympathetic nervous system, because norepinephrine and epinephrine increase cardiac contractility by activating beta-1 receptors in the heart. And also remember the pheochromocytoma, the tumor that can increase large amount of catecholamine, can also increase cardiac contractility. Higher intracellular calcium levels or taking a positive inotrope can also increase cardiac contractility, stroke volume, cardiac output, and blood pressure. Now let's talk about the other factor affecting stroke volume, preload, which is the volume of blood stretching the heart muscle at the end of diastole. Increased preload enhances stroke volume because the more the heart muscle is stretched during filling, the more forcefully it contracts. This results in higher cardiac output, but remember within limit. Preload is normally determined by the blood volume, specifically the volume of blood returning to the heart, known as venous return. The sympathetic nervous system increases venous return by activating alpha-1 receptors, causing vasoconstriction, which reduces the capacity of the venous system and forces more blood back to the heart. The sympathetic nervous system can also increase preload by increasing blood volume. That is through activating beta-1 receptors in the juxtaglomerular cells in the kidney, causing the activation of the renin, angiotensin, aldosterone system, and fluid retention. In general, blood volume is influenced by hormones such as aldosterone and antidiuretic hormone. Aldosterone, released from the adrenal cortex, increases sodium and water reabsorption in the kidney, increasing blood volume and venous return. Antidiuretic hormone promotes water reabsorption in the kidney, also increasing blood volume and venous return. So, increased blood volume and venous return will increase preload, which will increase stroke volume, cardiac output, and at the end, will increase blood pressure. The systemic vascular resistance, or SVR, is also known as afterload, which is the amount of resistance the heart must overcome to eject blood during systole. SVR is a major determinant of blood pressure and is influenced by the diameter and tone of blood vessels. Vasoconstriction increases SVR, leading to higher blood pressure, while vasodilation decreases SVR, lowering blood pressure. Vasodilating agents that can reduce SVR and blood pressure include nitric oxide, prostacyclin, and adenosine. So low levels of any of those biochemical mediators will increase blood pressure. On the other hand, powerful vasoconstricting agents as angiotensin II and endothelin will increase systemic vascular resistance. Also, sympathetic nervous system increases SVR and blood pressure by activating alpha-1 receptors, causing vasoconstriction. As you can see, the information we covered is summarized in this concept map. I hope it helps you learn about the factors that can increase blood pressure. Thanks for watching.